everybody. Today we're going to review the Blue Eucalyptus Energizing Massage. This is a wonderful massage for anyone experiencing fatigue, stresses in life, adrenal fatigue, low back soreness. Just a really beautiful energizing massage. First I want to review the setup, and what we need for this massage is the ginger oil, stimulating and warming oil. We need the eucalyptus essential oil. We need the sea fennel wax and the mighty mint. For the towel cavity, you want at least 3 to 4 wet towels, wet small towels, and 1 or 2 dry small towels, and then possibly even 1 larger dry towel, just so that you have it to cover the glutes if you need it. So let's go ahead and get started with the Blue Eucalyptus oil. In the protocol, we say 6 to 8 drops or 8 drops. I think we can really do with 2 or 3 drops. Essential oils feels and seems pretty strong, so we've been experimenting with 3 or 4 drops even, and are doing pretty well with that. So what you want to do is take the hot water, put it in the bowl, add your eucalyptus, and then come right over and allow the client to take a few beautiful inhales, nice and low in your belly. And then once again, beautiful. And then let's go one more time, nice and low in your belly, big beautiful inhale. And then go ahead and place the eucalyptus steam on a stool. And just place that right under their head. So after the inhale, we come over to the left side of the body. If you can remember to always start the naturopathic protocols on the left side of the body. And we're just acclimating ourselves with the body, preparing the body with nice compressions around the body. And then once you make one full, beautiful circular turn of compressions, again beginning on the left, you're going to spend a few minutes while the client is still draped and do some work on the traps and the occiput. So you're releasing tension in the traps. You're working gently on the neck with the purpose to release tension primarily in the occiput. And then you're incorporating the beginning part of your scalp massage. So once again, nice beautiful inhale, 2 or 3 drops of eucalyptus oil, placing that on a stool under the client so that they can breathe it in throughout this part of the massage. You take compressions around the body, and then you come to the center of the table and you release the traps. Work your way up the scalenes. Release the occiput and incorporate some nice gentle scalp work. Okay, now we're ready to undrape the left side of the body, and what's nice, if you can, is to take a hot, large, dry towel to use to drape over the glutes, has the client maybe feel a little bit more covered. And we're going to do our signature naturopathic diamond drape, basically making a diamond shape at the glute. And then if you like, you can just take a warm, large towel and drape it over that way. So large body parts, in both the arnica and the eucalyptus protocol have the oils. This oil is the ginger stimulating oil. You take about a quarter size. Try to remember to activate it in your hands. And then apply the oil first. And then you want to start with the Russian massage, large body parts Russian massage. And that is ulnar palmar friction. Ulnar palmar friction. And again, remember, this is the only time you're working on the back side of the legs. So spend a minute or two, 3. If the client comes in with any other request to spend more time on the body, different body parts, then of course adjust the timing accordingly. But for the most part, 2 or 3 minutes, maybe 3 passes, ulnar palmar friction, and then getting into the back, low back, ulnar palmar friction. A little bit more difficult to maintain that stroke up around the scap. So you would just integrate down. And it feels really good, or at least we've heard, it feels really good when you try to go from the Achilles and incorporate your strokes and come down and off the wrist, allowing the nervous system to really relax. Okay, so we do that on the left side of the body, and then we would go ahead and repeat the same on the right. Okay, so we've just completed our diamond drape on the left side and then the right side of the body. Ulnar palmar friction from the Achilles up the back of the leg, as far up to the glute, then coming to the low back, changing the stroke ever so slightly to get around the scaps, and then coming down through the arm to allow the nervous system to relax as best as we can. Now you're going to begin to prepare the back. Once again, a little goes a long way with these oils, and in fact, the more you work them, the better they get. So about a quarter size. Remember again to rub your hands together to activate the ginger and the lemongrass. And then we're going to just apply on the back. This will be the only time that you actually use the ginger oil on the back. So try to get a nice spread here. There is some work up the lateral side of the body, so we may want to apply some there and then just come down the arms. And then heading down the table, we come again to the left side of the body, and this is the point in the protocol where we're going to prepare the low back, kidneys, adrenal glands. Again, this massage is energizing and hopefully reducing fatigue in the body. So we're kind of anchored at the glute. We're feeling for the attachments. We're coming up to the 12th rib and preparing the low back kidney area. Also can work cross table. And at that point, maybe you want to anchor on the lower part of the hamstring. And again, I'm working right at the sacral attachments, the iliac crest. I'm coming up around QL and then kind of using the 12th rib as my marker here. So my work is purposely focused on the attachments at the sacrum and at the iliac crest, working laterally up to the 12th rib, and then also scooping and coming across. And what you're trying to do is really activate the kidneys and enhance the circulation in this part of the body, preparing for the very specific trigger point therapy, meridian therapy that will happen next. So then again, coming over to the right side, preparing the kidneys and the low back, coming across, anchoring, maybe doing a couple little pulls and lateral strokes here. And then just finishing the stroke in whatever feels right to you. So then the next thing we're going to do is come back to the head of the table, and we are going to continue with our specific low back work with circular digital compressions beginning at the sacrum, right along the paraspinals. You're about a thumb length away from the spine, and you're just coming up nice circular compressions until you feel you're up right at the 12th rib, and then you're going to do a lateral spread. And the key is to really go laterally so that you can relax the entire low back and that you can perform your work over the kidneys and the adrenal glands. And you can scoot back up to have the strokes make sense to you. And then if you'd like, you can go ahead and do that again. And you can hear a little bit of crunch crunch here. We know we're on the right spot at some of the attachment sites where there might be some adhesions. But the point of this part of the massage is to really prepare the low back, kidneys, for our more specific meridian work, which is coming. So nice lateral spread. Okay, now we have the wonderful opportunity to use this fantastic Mighty Mint product. And so, somewhere in between a dime size and a quarter size, a little bit goes a long way. Spread it in your hands first to try to warm it. And you're really focused down the paraspinals, preparing the back for the trigger point therapy. And then come on up and do a nice spread here. Coming down the paraspinals with the Mighty Mint, preparing for our meridian work, and then up. And when the Mighty Mint hits the ginger oil, it's this wonderful emulsification. You can feel the texture of the product's meat, and how it feels on the skin is really terrific. So a little, again, goes a long way. We've just applied the Mighty Mint purposefully down the paraspinals and then along the back, because this is, again, the last product. We have the two products on the back, the first being the ginger root and now the second being the Mighty Mint, and this is the only product that we will apply to the back. All right, now we are ready for the first 6 meridian points, trigger points out of 11 in this massage, and there are 6 to begin with on the back. You start, we think it's a little bit easier to do them bilaterally. You can absolutely do it unilaterally if you'd like, being very mindful to protect the thumbs of the therapist as best as you can. We are starting with T2, which is really right at the rhomboids, inferior angle of the scalp. And you'll know you're there because it kind of sinks in. Sometimes it feels a little bit clicky. And you're about a thumb length away from the spine. So if you're here, you're too close. If you actually can see that spine coming through the skin like that, you're too close if you can actually feel the vertebra. You're a little bit out from that. So 1 full thumb length out so that you're actually on the musculature and you can feel it release. So first point, T2. Then you slide down to T10, and the best way to find that is to look for the 12th rib and then gauge about 2 thumbs up from the 12th rib. At the 12th rib, we should be right at T12, so 2 thumb lengths up, we're at T10. And again, you're holding for 10 seconds, being mindful of your own posture and self-care. There's a number on your thumbs. And then you slide down one thumb length to T11. And the same thing, you're holding for 10 beautiful seconds. Oftentimes the client will just naturally begin to take their exhale to allow that thumb to sink in a little bit deeper. Then you skip and you go to L1, again for 10 seconds, L2, 10 seconds, and then you slide up laterally until you sink into the space in between ribs 6 and 7, and it's very crunchy in there. It's great to help to release the scaps. You're kind of right at serratus anterior. And those are the 6 points on the back, each held for 10 seconds. Certainly you can repeat a second time if you'd like. And so to review, we have T2 at the rhomboids. We have T10, T11, L1, L2, and then we slide up laterally and sink into the space in between ribs 6 and 7. We've just finished the 6 trigger points, meridian points, rather, on the back, and now we have the opportunity to work freestyle on the client. 6 to 8 minutes, focused on any issues they may have mentioned, working again on the low back, and specifically through freestyle, releasing tension around the shoulders, scap, incorporating maybe a nice stretch, mindful in our intake of any rotator issues. And again, 6 to 8 minutes, really working in the Mighty Mint with the ginger root oil and focused freestyle on the back. When you're completed with the back, you may now go and reach for a nice wet towel. And one thing to remember is, for the most part, whenever you use Mighty Mint, it's followed with a hot, wet towel that really helps relax the body and enhance the sensory stimulation of the product and the heat. So a nice hot, wet towel, careful not to remove the product. You're really just trying to use the medicinal properties of the heat mixed with the products. And then we do our final stroke, which is really an abbreviation of myofascia technique of skin plucking, and you kind of pluck the skin through the towel. Maybe you'll do 3 lines. It's just a gentle pluck, lift to help with circulation. And then that hot, wet towel comes off, and you go ahead and cover the body. At this point, we want to instruct our client to turn, and we will finish the remainder of the protocol while the client is supine. So go ahead and, as soon as they go ahead and make their turn and are comfortable lying on their back, we take 1 drop of the eucalyptus oil, and careful because it does come out pretty quickly. And we're going to ask them once again to do a nice big beautiful inhale, waving the essential oil right around the head. And then one more time, nice big beautiful inhale. Wonderful. We've had a couple times with the hot water bowl falling off of the chair, so I'm going to be careful here to bring that over here. And now, as soon as they've turned and they've inhaled that wonderful eucalyptus oil, now we're going to work the specific sinus points on the face and really do a very mini sinus treatment on the scalp face. And there are 3 remaining sinus points that we'll incorporate. So third eye spread, And conceptually, we're working our way, although I started in the middle, went down and up, we're working our way down to drain the sinuses. So we start on the third eye, temporal, lateral, spread. And then we come to the sinus points right at the eyebrow. And it's just like a gentle little push squeeze. So you're just gently working around the bone and sensing the sinus point right here at the medial tip of the eyebrow, temporal bone, frontal lobe, and then working our way down. And then coming to right under the cheek and sensing ever so gently with the tips of our fingers, working our way around. You can incorporate a little mandible work if you'd like. And then we have the next 3 points, so 6 on the back and 3 on the face, and those are done with the kind of the ball of the pinky finger. So right at the below the orbital socket here, the bone, and you just hold and then make your way down one little pinky length and then one more. So 3 little circular turns with your pinky beginning here. 1, 2, 3. And then incorporating any scalp work. Bit of the ears. And that completes our sinus work on the face. At this point, we're going to take a pea-size amount of the sea fennel wax. And this, as in with all the products, and especially this product, a little bit goes a long way. So a pea size really is all you need. And you spread in your hands. And we're going to spread on the décolleté, pecs, and then work our way around the back of the neck, the scalenes, again coming all the way up to the occiput, purposefully releasing any tension in the neck. So this is the point in the massage with the sea fennel wax. We've done the spread on the pecs, on the décolleté, feeling for attachments up around the clavicle, and then coming around the shoulders, feeling for C7, and then making your way up and working the neck. So we have 4 or 5 minutes to spend here working on the neck. We've experimented with a couple different ways of when to use a hot towel and when not, and a lot of people seem to like the flow of not using the hot towel yet under the head. So we turned the client, we had them do an inhale with the eucalyptus oil. We started with the third eye, spread on the forehead, worked our sinus points on the face, got the 3 tiny little points coming from the orbital socket down, incorporated the scalp, and we took a pea-size amount of the sea fennel wax, applied it on the décolleté, on the pecs, worked our way across and over the shoulders, up through the neck, and then we do our specific neck work here. Before we get up to get our next hot towel, you want to, while seated, seems to be one of the most comfortable ways to get at this lung 1 treasury point. So this is our 10th point in the massage, and it's right here below the clavicle, kind of, you just can sense where the insertion is. So allow your fingers, your thumbs to kind of sink into that spot right here below the clavicle. And you'll hold that for 10 seconds. And then you'll get a nice hot, small towel. This is a great opportunity to use a dry towel so that when you eventually put it under their head, the sheets don't all get wet. And you kind of triple fold the towel, allowing the medicinal properties of the heat to come right over that meridian point that we just worked. And then taking the towel, sliding it under the neck. The less times you can lift the client's head, the better. And then we're going to end this part of the massage, the beautiful neck traction, identical to the one in the arnica massage. Careful not to pull up, but you're just gently pulling horizontally. Careful to come back to center so that you don't go too quickly from left to right to shift the equilibrium. And then nice gentle turn, careful of your own body mechanics. Really making the turn here with the upper hand. Coming back to center. And then this towel should just gently slide out. You don't have to lift the client's head even again. And then you'll go ahead and roll the towel. And they're all set and rested comfortably for the remainder of the massage. Now is a great opportunity to cover the eyes. You can do that with an eye pillow. You can also do that with a nice warm towel. And now we're set for the arm work. So again, coming to the left side of the body. With the arms, you really only need about a dime size of the oil. And working on the arms is completely freestyle, so applying, working the arms, forearm, hands with the ginger oil. What you do want to try to remember is to incorporate some sort of joint mobility here to get the synovial fluid in the shoulder joint activated and moving. So however it feels right to you to do a 360 rotation, whether the arm is bent here and you're making your turn this way and feeling the joint mobilize. Some people like to take the arm this way. Again, we've done this in the arnica massage. And getting your 360 that way. So we'll start with the left. Apply about a dime size of the ginger oil. Make sure that oil is activated by rubbing your hands together. And then we'll come over and do the same thing on the right. Okay, at this point in the massage, we have the opportunity to do some abdominal work. So we would ask the client, would you like your belly work done?
Of course.
And they reply, of course. Sometimes it's nice to ask the client at this point in the massage. They're more likely to feel more relaxed and comfortable and allow you to work on the belly. Some people like to ask the client before they get on the table. That's fine too. I typically ask them right at this point very gently, would you like some belly work done? Would you like your abs worked on? Even for a male, we'll cover the breast tissue, the pecs, with a sheet or a towel and disrobe the abdominal area. Okay, we have another opportunity. So our second opportunity to use the Mighty Mint. The first opportunity was when we prepared the paraspinals for the trigger meridian work on the back. Now we'll use the Mighty Mint on the abs, and we'll finish with the Mighty Mint in one of the last parts of the massage on the feet. So you want to get the Mighty Mint on and spread it across the abdominal area, and then following the GI tract and really being mindful of any adhesions up along the diaphragm, xiphoid, nice beautiful circular motions, using the hip pelvis as an anchor, working our way around, stimulating hopefully the digestive system and the parasympathetic response. So beautiful circular motions. Again, try to incorporate some sort of lateral work, reaching back across and behind with gentle strokes over the kidney. Sometimes in order to do that bilaterally, then you have to come across to the other side of the table, picking up where you left off in your circular strokes, releasing the low back, reaching around QL here. And then you want to end the abdominal massage with some gentle little tapotement. So you're following around and then you're stimulating with some gentle tapotement, following around, stimulating with some gentle vibration tapotement. And it's really, really gentle. You have like a really loose fingers, loose wrist here, and you're just gently tapping to stimulate the digestive system. And then, like in all the protocols, whenever you use Mighty Mint, you have the opportunity to enhance that feeling, that scintillating feeling with the mint, with a nice hot, warm, wet towel. And again, we're just trying to get the medicinal heat properties of the towel. We're trying not to purposely remove the product. Just spend a minute less than with the hot towel. Remove, cover, remove, and now we're ready to go to the legs. So on the legs, just like the arms and when the client was prone, we're going to use our ginger oil, stimulating ginger oil, and we're also going to use our Russian massage strokes. On the legs, we'll also incorporate releasing the ITB and adhesion specifically in that area of the body, as that helps to relax the low back as well. So a little bit less than a quarter size of ginger oil. We activate in our hands, we apply, make contact with the body, and then we'll do, once again, Russian massage, careful of the shin bone, working ulnar friction primarily right up against the peroneals, skipping over the knee, and then up on the thigh, on the quads, and then once again, ulnar palmar. The only opportunity really to work the quads, so a little petrissage maybe, and ulnar palmar friction, working our way down. And then, in whatever way feels right to you, you want to spend a moment on the IT band, feeling any adhesions on that band from the hip all the way down to the patella, finishing that stroke coming off the foot or whatever feels right to you. And then I like to end sometimes when working the quad with some compressions over, just to continue to release the IT band that way. And then we'll go ahead and do the same on the right leg. So now we have 2 parts left. We are going to focus on the lower part of the legs and the feet. And we do that with another small quarter size of Mighty Mint. Again, spreading and warming in the hands, and it's easier with this product if you apply bilaterally anterior and posterior part of both legs, lower legs and feet. And then come and do your specific leg work. Otherwise, you won't have enough product left for the right leg, and you'll wind up having to get up twice from this position. So we've just taken about a quarter size of the Mighty Mint. We've spread it bilaterally on the lower legs, anterior and posterior. And now we're doing some specific footwork. Maybe a little bit more specific as far as some of the reflexology points, really trying to get in and release tension in the tiny bones of the foot, following up along the toes. And it's important to do that specific work because there are several sinus points that lie in the foot, especially in the toes. And so anything you can do to do some acupressure points on the foot. The sinus points really lie in between the toes here, on each side of the toe, especially the big toe. And you'll spend maybe 2 minutes, 2.5 minutes per leg and foot. And then before you complete the foot section, we have the last of the 11 points, which is spleen 6, which is about a hand length from the medial malleoli. So about 4 fingers or a palm length. And you'll kind of feel up against the shin where you sink in. This is a very sensitive point, particularly on women anywhere in their cycle, a contraindicated point in pregnant women, and just a tender point all around. So you sense for that last point, spleen 6, about a hand length up from the ankle. And you just sink in there like we have with the other points for about 10 seconds. And then once again, we'll go and get our last hot, wet towel. Because we've used the Mighty Mint, we have the wonderful opportunity to add heat. And again, trying hard not to remove the product, but to use the medicinal properties of a beautiful, warm, hot, wet towel. And then we're going to end the foot section, just like we do in the Arnica protocol, with some gentle traction. And it seems easier to do traction over the sheet, so this is pretty much the order that I've done it in. Taking the Mighty Mint, about a quarter size, applying in my hand, spreading between the 2 hands, applying bilaterally to both legs, working the specific points in the feet, going and hitting that last meridian point of spleen 6, using a beautiful hot wet towel, and then finishing with some gentle contraction. And now we're going to complete the massage with our final drop of eucalyptus oil, and it does come out of the jar pretty quickly. Rubbing our hands together. Nice big beautiful inhale. And once again, big, beautiful inhale. I always like to remove the eye cover pillow at this time while I work on the final points in the head so that they are preparing for the massage to end. And you're going to hit the very last points. They're not specific points, but the area we're focusing on once again is the medial occiput. And then the gallbladder points up and around the ear. So we've ended with one beautiful drop of eucalyptus oil, a few final inhales, coming up and once again releasing and working the medial occiput, feeling for those few points, non-specific points up and around the ear. The sinus points sit right at the C1 at the occiput, so you can just gently hold the head as well, releasing those final sinus points. And we are complete.